So, Bismillahirrahmanirrahim. Today, I'm gonna take like a random topic. I hope it will be a short session because I've planned like that. But let's see. Okay, so the main chapter we are gonna choose today is neurology because this is our neurology going on with our August batch. So August batch people already all the topics lectures already you have got in your website. So the topics I felt like you need to do a more deep knowledge because last few diets they're having a deep on those topics. That's why I'm taking this extra improvising class. Okay, so first of all, very kind request, just stop your videos. You can unmute your phone whenever you want to talk. I mean, your mic, it's okay. But please stop the video as it's being recorded. So just for your personal safety. Okay, dear? So before starting, I want to know how much you guys have idea about neurology. A little bit of like a rapid fire of questions. Let's see. I want you guys to respond. You can just so let's talk about dementia. What is dementia? This is like loss of memory, forgetfulness, right? There will be a loss of memory. That is the dementia. Very layman term, loss of memory, right? So now, please stop your video. Somebody's video is on because it will be very difficult for me again and again going back and to stop the videos for all of you all. Okay, so just a kind request to stop all of your videos. Okay. Anyone who is with on video, please, please, please stop the video. I think I have to. Yeah, thank you. Okay. So I was where dementia, right? So just let me ask you some quick question. If your question there is loss of memory, some people they came to you, okay? There is like loss of memories over there. And along with that, they have told you that there is cortical atrophy. Can you tell me the diagnosis? There is background noise. Please mute yourself. And when we want to talk, you can unmute, no problem. Anyone, please respond. Dementia. The people, maybe an old man, 65 years old. He came with Alzheimer. Very good, very good. So this is Alzheimer's. So Alzheimer's, whenever you see atrophy in the cortical area or in the hippocampal area, especially they mentioned like this too in your exam. Okay, so cortical or hippocampal, these two area, if this is atrophy with dementia, this is definitive. This is definitive Alzheimer. Okay, so let's go to the next one. Again, I want you guys to answer this one. Dementia, okay. He is Parkinson's disease patient. There is also, he developed a visual hallucination. Answer me.
Lewy body dementia.
Very good, Lewy body dementia. So they will give you a Parkinson's disease, okay? And they will tell you he came with dementia, and they will obviously, the most important point to diagnose this as Lewy body dementia, you need this visual hallucination. Without this visual hallucination, it is not Lewy body. So even if it is Parkinson's with dementia, this is a normal dementia. It could be Parkinson's disease with Alzheimer, but it is not Lewy body unless otherwise he's having the visual hallucination. Is it clear? Is it clear?
Yes.
Okay, thank you. Now come to the next one. Okay, so dementia. Dementia. So let's see. There is like history of recurrent stroke. Okay. What is this diagnosis?
Vascular dementia.
Vascular. Very good. Because there is a history there is a history. Okay, cardiovascular disease. There is a history of cardiovascular disease. Nothing else important mentioned over there. It is the only clue in the question. Okay, that is how the question came. If like that, yes, vascular dementia. Along with that, if any other clue is there, that time this stroke, you can take it as just a history. Maybe with this dementia, if like they are telling it is a PD plus visual hallucination, obviously it is not vascular. That time you need to choose with Lewy body dementia. But when only clue with the cardiovascular disease, only is the clue with dementia. This is your vascular dementia. They want this answer. Okay. Now, come to the next one. Again, dementia. Okay. Dementia, there is maybe there is what? Maybe there is a gait. No, gait. Let me come to the one next time. Later, I will go with cerebellar. Maybe there is cerebellar ataxia. And along with that, there is some eye movement problem, some vision problem, and they find out there is ophthalmoplegia. Okay, OPTH, right? Ophthalmoplegia. What's that?
Yaka, anterior cerebral artery syndrome.
There is ophthalmoplegia. They cannot move. Cerebellar ataxia. Cerebellar. There is ophthalmoplegia. Patient is alcoholic.
Oh, then Wernicke's encephalopathy.
Wernicke's. Very good. Very good. Excellent. So this is the Wernicke's, right? So whenever with this, they are telling that there is confabulation. Confabulation, what will it? Korsakov, very good. Mashallah. So, you know all of this. This is the thing from dementia, right? Dementia with chorea. This patient, father also have same chorea, involuntary movement. Huntington, dear. Huntington, autosomal dominant because of the history of father. Autosomal dominant. Huntington disease. Okay. Dementia. Then, along with, there is the word myoclonus. So many features are there.
Creutzfeldt Jakob disease.
Very good. This is the Creutzfeldt Jakob disease. Very good. Thank you so much. So let's start with our Creutzfeldt Jakob disease. That day I a little bit discussed while I was doing the past paper. Then I found out some questions from my enrolled doctors actually. Some of them they missed as I'm not giving that recorded session of the past paper. So I decided to take that description in a more descriptive way to have a very deeper knowledge, okay? And even if you are someone from part 2, aspirants are there, this will be also helpful, okay? So this will be a deeper knowledge of cesarean, whatever the questions coming from part 1, part 2, I will tell you, and whatever part 2 I will specify. So part 1 people don't bother about that one. Okay, I will mention, don't worry. Okay. So as I told you, you are already answered me, right? That there will be what? There will be obviously a memory loss history, they will tell, and there will be the word myoclonus. Or maybe this specific word will not be there. Maybe they will tell you myoclonic jerks. This word also they are using. Okay. Or maybe they will tell you jerking movement of the muscles. Please mute yourself. Somebody's. Thank you. So myoclonus, myoclonic jerk, jerking movement of the muscles, any of the word with that, if there is a dementia, ignore any other thing in that question if there is in your option CJD. Okay, this is the most important thing to look at the question. Along with that, so many neurological feature, it could be pyramidal syndrome, it could be extrapyramidal syndrome, it could be with ataxia. So many things will be there that to make you confused. If it is like any stroke type of feature, why they're telling this jerking, right? Any stroke type of feature, you will not get this type of muscle clonus type of movement, will you? No. So whenever they're giving you this word, they don't want you any kind of a stroke, any kind of territory, any kind of blood supplying. They want you CJD. If in the option CJD is there. Very simple way to diagnose at your exam hall. But definitely the whole question will be difficult. They try to make it difficult with so many unnecessary neurological symptoms. Ignore them. Ignore them. Okay, dear? So first of all, this is the thing that you will find it out in your question. Now come with the description. So what is it? What is the pathophysiology? Nowadays, for last 2 years actually mainly, they are giving mostly the pathophysiological background of diseases in the questions. This is the new ad, because they already find out that you guys know everything about the how to diagnose. Maybe they know we are keeping emphasizing on the diagnosis, on the simple management. So they now go a little bit backward, okay, to get the newer people to a little bit confused. Okay, so this is the new addition that actually whenever you are doing any kind of disease, try to read about the pathophysiology, at least a word to remember. Okay, so here the word I want you to remember, the prion protein. This is the word I want you to remember. Nothing else. There is pathophysiological thing, how they are protesting to make the enzyme to not work on them, making the beta sheets plate. I don't want you to remember those. I want you, the problem is with the prion protein. And I want you to remember another word, mad cow disease. What is mad cow disease? Actually, this prion protein is actually causing this disease in a bovine animals, in cow and oxes like that. When they're forming one kind of disease in a bovine animals, that is known as the mad cow. When this prion protein is causing problem in our people's, the human beings, human body, that time actually this is the CJD. Very simple. Try to remember it very simply. So the mad cow disease, when it is in the cow, when it is in the human, it is CJD. I want you to remember the prion protein. That's it. This is your pathophysiology. You don't need to know anything else from here. Okay. So come, Khalas, this is the pathophysiology. Now, how they will give you the history? Usually, they are not giving you the background because it is idiopathic mostly. But sometimes some question there is in some question bank, they're giving a history of brain surgery. Some neurological surgery, they will tell you that he underwent this. There is a background noise. Mute yourself, dear. If you want to talk, you are allowed. Anyone, please. I don't know who's background. Okay, so thank you. So yes, some question, they will give you this brain surgery background that he had maybe before 6 months a brain surgery. Now, recently he developed this same, the specific thing I want you to remember, dementia plus myoclonus. So this can be the cause. So this is not as a question it is coming. It is a clue in your question that it will help you. That because of the brain surgery, this CJD and this happened. Okay. So finish. This is the history. Now come types. There are 2 types. One is with the young people. So whatever young, whoever new generation, they are the new variant. So that you can remember the word new is with young people. New generation is young, right? Old generation, they are with sporadic. How to remember this? New variant. So new is with the young people, usually 20s, 30s, early 20s, 30s, average they are telling 25 years like that. This person less than 30 years, yes, they are young. Okay. So old, those are having with sporadic. So you need to know these two types name. Why? Because investigation, to remember the investigation division, for young people what you will do, for old people what you will do, there is a difference. There is a difference. That's why you need to know. Okay. So now come with the investigation, what you will do. Investigation, the very basic thing in your question, whatever dementia it is there, whatever dementia, if they're asking you, what is the early diagnostic investigation? What is your next plan? Immediate investigation, whatever it is, what you will do, anything, dementia, any people, just think it easily. Any people comes to you, you are a doctor, and he is telling that I'm having some memory loss, what you will do? Will you take the CSF fluid? You will do the lumbar puncture immediately? No, right? You are not going to the invasive procedure. So whenever there is dementia, first of all, as a doctor, your basic sense will tell you to do some image test, and that should be MRI. So if it is a history, this is a tips. This is a tips for whole of your dementia question. It could be Alzheimer, it could be Lewy body syndrome, it could be your Wernicke's, whatever dementia. If they're asking you what should you do now as a next investigation, your answer should be MRI. There is a question. Just I'm going a little bit, I will jump. It was actually Lewy body syndrome question. They told what is the next investigation plan. Most of the people, they choose the DAT scan. And it was a wrong answer, because next investigation, it should choose as MRI. You should exclude that it is not Alzheimer. So whenever dementia, especially in old people, even in young people, you will do MRI first. Image is first. You have to exclude that he doesn't have any kind of brain pathology, any kind of structural pathology over there. Then go for the next one. Very basic sense. Apply your basic sense for MRCP part 1. This will work on your basic sense. You know, some basic sense will give you more accurate question than your bookish knowledge. Okay. So this is the thing. And you will not get in past medicine notes MRI uttered. It is not uttered under Lewy body syndrome. Go to past medicine notes. You will not get MRI, but there is a question. So this is your basic sense that actually we will do MRI first. Then yes, when excluding Alzheimer, actually clinically it should be diagnosed Lewy body syndrome. But if they are asking for this investigation, yes, do the MRI, exclude Alzheimer, then that scan. But if they don't want that MRI, they will definitely not even mention this as an option and not even mention as a next investigation. They will ask you the definitive investigation. Yes, for definitive investigation, that scan is the right answer. So you need to understand the question. Dr. Jobai, would you please switch off your videos here? Would you please? I think it stopped, right? Okay, thank you. I'm sorry. Is it clear? I'm sorry for distracting from your CJD, but as I'm assuming that already August people, they are starting to do my neurology lectures. They're almost maybe doing that. So I'm trying to interconnect them with this from here to there. Okay. So now come with the where I was with CJD, right? So the investigation again, if they're asking for CJD, what's that, Dr. Priya? Okay, clear. Thank you, dear. Thank you. Okay. So the first thing, if they're asking you next investigation, you are going for MRI. This is your MRI. Then next, if they're asking you, you will go for invasive one. You can go for LP. You can go for EEG. There is nothing that which we will go do first or which we will do next. MRI is first one. It is okay. But the other thing you can do. Okay? Yes, Dr. Rubab, right? MRI and CSF for LP, right? Now, I'm coming one by one. So, very good, Dr. Rubab. And now, the last one. Tell me, the last one that day, I don't know which people you were there. Last one, I told you a newer technique is there. Can you tell me the newer investigation name? Now they're doing this for CJD. Anyone? Anyone?
SPECT scan.
No, SPECT scan, that is for Lewy body dementia. That is the same DAT scan. DAT scan or SPECT CT. This is the same thing that we are going for that dopaminergic, that receptors. We are going to find out that one. That is with to find out if it is Parkinson's or not. Okay, dear? So that is different.
Okay.
Okay, so this one is the new name.
Real-time quaking.
Very good. Excellent. Real-time quaking induced conversion. This is a new thing. Remember this. This is a new thing. They love new thing, and investigation also important for your part one also. So this is the important thing. Real-time quaking induced conversion. Only if you know the name, I'm happy. I'm more than happy with it. Now come where what you will get in which case. First come with MRI. MRI. Let me first tell you, as I told you that there are two types. So something will be positive in case of new variant, which will not be positive in case of the old variant, sporadia. So this is always making people confused. So from my side, the tips will be that start with the head. Start with the head. New generation, their brain is working first, right? It is like to just make you remember. New generation will think first, like, right? So whatever you will get in MRI, actually this is found in new variant. Very easy to remember. And whatever you will find in EEG or LP, this is especially positive in case of sporadic or old people. So very easy to remember. Head is with new, the others are with sporadic. RTQIC with everyone. So this is, they will not ask you. Okay, they will ask you for new variant and for sporadic. Is it clear or not? Now I will go to the findings only. But before that, let me clarify you. You guys clarify me if it is clear or not.
Yes, clear.
Okay, thank you. Thank you so much. Now come what you will get. What investigation report they will give you, that with this, just it will click your mind that yes, it is the new variant. So MRI, the first one, as I told you. Now tell me, MRI with whom? New variant or old? Or sporadic?
New variant.
New variant. Very good. Very good. Now MRI, they will mention some words, pick that words only and go to the diagnosis. What are the picked things? They just remember three things. The same sign, but in a three different language questions are there. So I want you guys to remember all the three names or the wording that they will use in your question paper. First one, they will use pulvinar sign. Second one, they will use hockey stick sign. I'm coming to the description later on. They will use hyper intense signal. Hyper intense signaling. They will use the area. What are the areas they will use? They will use basal ganglia, or maybe they will use the thalamus. Even some questions are there, they are not using thalamus, they are using the nucleus name of the thalamus, the posterior part, posterior nucleus name. What are those? They are telling hyper intense signaling in the putamen. I'm remembering it as personal computer, PC. This is in the putamen because this is so difficult to remembering everything, right? So this is my PC. putamen and caudate nucleus. So they didn't mention that this is the part of thalamus. So if you don't know this putamen and caudate nucleus, actually the name of nucleus of thalamus, how you will answer it there? So you need to know all these things. And what is this? This is actually the sign that it is mentioned as a hockey stick sign, the same name as Pulvinar sign, other name only. Okay, this is the other name, Pulvinar sign. Actually, this is the hyperintense area in this area that is looking like a hockey stick. It's looking like a hockey stick. Okay, so let me show you the picture.
And what is it?
This is a very nice picture, I love. Oh, that's right. Okay, can you see? Can you see the red that they have drawn? This is looking like a caudate nucleus. I mean, this is like a hockey shape. This is in the thalamus area, this basal ganglia area. Okay, so this is the sign that you will find in CJD. Picture important only for part 2 people. And to get the idea, just I'm showing you part 1 people to see the, but don't try to remember the picture. Part 2 people, please, this is the sign. They will not show, draw the picture of hockey stick in your exam hall, but they will give you at least the word myoclonus in your question, and they will give you the MRI picture. So this is my Pulvinar sign, hockey stick sign, hyperintense area. The same thing, just alternate name. Is it clear?
Yes, madam.
Okay, thank you. Next one, I told you LP. LP what? Lumbar puncture. You will take the CSF. CSF, you will find the same protein. Now tell me. I just tell you the name of the protein responsible. What is the pathophysiological protein name? Tell me the name.
Tau protein.
Tau protein. Yes. And this is the number that they're using to code it 1433. Very good, Dr. Bab. So this is the prion protein 1433. Okay. So this is again, tell me, new variant or sporadic, they will be positive?
Sporadic.
Sporadic, excellent. Come with EEG. Come with EEG. They will use the word, there is like spikes. Okay, just a minute. Just a minute. Just sleep. Okay, sorry. So they will use that there will be sharp wave complex periodically. Periodically, there will be sharp wave complex. It could be biphasic. They could use the word biphasic. Actually, it is biphasic or triphasic. One question also I got in past paper, they used the triphasic. So there will be like high amplitude sharp wave complex. Okay, in your EEG. So if any of this, if they're giving you this EEG interpretation, definitive diagnosis, Mamash. So, acha, ye karo, to close karo. Switch it off. I don't need it anymore. Switch it off. Okay, sorry. So if any of this interpretation is mentioned in your question, don't even look at the scenario. Don't even if there is no myoclonus, the word is there, only dementia and some other features. If it is definitive features of interpretation of your investigation, like there is prion 1433, definitively it is CJD. If there is biphasic or triphasic, like sharp wave complexes in EEG, it is your CJD. If there is Pulvinar sign, hockey stick sign, it is your CJD. So in this investigation positive, whenever it is positive, Now ignore the history. Now ignore the history. You are definitive. You are diagnosing this already. Okay, dear? So again, EEG for whom? New variant or sporadic more? EEG.
Sporadic.
Correct. Very good. Very good. So they will give you the interpretation and they will give you both the name. They will tell you that LP, they find out prion 1433. So you will get option new variant. You will get option with sporadic. So obviously 1433 is there. It is your sporadic. So that's why you need to know all the interpretation of these investigations. Is it clear?
Yes.
Okay, thank you. And there is no treatment. They will die. There is no treatment. And also no need for part 1 any treatment. And actually there is no treatment. So any question from CJD? Any question here? No question? Okay, okay. So just one thing, mostly this dementia history, you will get that it is so rapidly. Maybe within, they will tell you suddenly he's having memory loss within the last 2 to 3 months. So it is so rapidly. It's not like Alzheimer. Alzheimer is like so slowly progressive disease. He will forgetfulness will be slowly appeared, not rapidly. Suddenly one day they will wake up or within 1 month they are telling, I cannot remember anything or what happened. You are feeling like, oh no, why he's not remembering. So if rapidly dementia, usually this is the main theme actually, that CJD actually they are having rapidly dementia. These features are coming very rapidly. But still, it is not important for you guys, just as a bookish knowledge, I'm telling you. Just if you got the loss of memory with this myoclonus, that is enough to diagnose your CJD. So may I proceed on with another topic? May I?
Yes, madam.
Okay, thank you. So now come with the something else. Do you know about anything about pheochromocytoma? What is that?
Tumor of the adrenal medulla.
Very good. Tumor of the, this is a kind of neuroendocrine tumor, right? Tumor of the adrenal gland. Very good, very good. So I'm starting with something else, no? Endocrine. Don't worry. I'm going to neuro. Okay. So whenever pheochromocytoma is there, in your mind, 1, 2, 3 should strike for MRCP.
5 P's will be there.
Yes, yes, dear.
5 P's will be there.
Yes, 5, actually 5P in a different way people are remembering the mnemonics. So if you're remembering with 5P's, okay. So someone is asking something. Yes, Dr. Priya, in a sporadic case, if there is EEG, MRI, CSF, what should we choose? Sporadic case, they if they're asking you any case, the next one, you have to, even in sporadic, you have to go for MRI, dear. Okay, if they're asking you the next treatment, okay, and they will not make you confused with all the options. They're not that much cruel. Okay, they are cruel, but not that much, not to that extent. Okay, but yes, if next they are asking, even if it is sporadic, earlier investigation should be MRI, but a very good question, Dr. Priya. Thank you. You will go with the basic sense. Okay. So now come with the, as I told you, Lewy body dementia. There is, it is not uttered in your bookish knowledge that MRI you should do, but the answer in that MRCP questions, it is the answer was selected as MRI because they want to exclude that Alzheimer. Okay. So now come with the pheochromocytoma. I want you to remember 1, 2, 3, the association of pheochromocytoma with some diseases, at least for your MRCP part 1. With 1, remember neurofibromatosis type 1. You will get pheochromocytoma in neurofibromatosis. I think already you got the lecture over this. So neurofibromatosis type 1. Number 2, with 2 you will remember men 2 and men 3. So these two are associated with pheochromocytoma. Number 3, you will remember VHL, as there are 3 letters and the chromosome number is also 3. So you will remember with 3 VHL. Very easier way to identify pheochromocytoma, even if with history in your question, to diagnose, to reach the diagnosis, which disease actually they are indicating you. So just try to remember in this way, it will be easier for you. So the association mainly with, at least for your part 1, these 3 diseases are important. Association with pheochromocytoma. Okay, neurofibromatosis type 1, that's why I mentioned number 1. Men 2, that's why I mentioned number 2. 3 later, and chromosome number 3, that's why VHL, von Hippel-Lindau syndrome. So I'm here to discuss about von Hippel-Lindau syndrome. That's why I did the drama. Okay. VHL, von Hippel-Lindau syndrome. So what is this? This is a garden of carcinoma, all kind of tumors, a very bad disease, a very bad disease. Okay, this is a very bad disease. And now tell me, what is the chromosome number? I just uttered it.
3.
3. So you'll never forget that. 3 letter, number 3, association with the pheochromocytoma. Pheochromocytoma. Okay, one important